and welcome. You're watching the Health Talk session by Yashoda Hospitals. While some rain after a hot and humid day can be sweet and refreshing, but the fact cannot be denied that it could bring in some monsoon illness as well. The good news, however, is that staying healthy during monsoon season is as simple as taking the right precautionary measures at the right time. So in this episode, let's discuss on how to stay safe and healthy, especially during the monsoon season. I'm Dr. Lakshmi, and let's welcome Dr. Shashidhar Reddy Gutta, Consultant Physician and Diabetologist from Yashoda Hospitals, Malakpet. Welcome to the program, Doctor.
Hello.
So, Doctor, the monsoons are here and the monsoon-related illness are on the rise. So, why do you think that the admissions and the hospital visits are on rise, especially during this season?
Generally, what happens after the summer, once the temperature drops, once the rainy season starts, so there will be activation of many of the viruses in the community itself, and most of the diseases which we see early in the monsoon season are waterborne diseases, like especially like typhoid, diarrhea, acute gastroenteritis, and heat stroke also one of the commonest one which we see. And malaria is one disease which is very common, which we see early in the monsoons once the temperature starts falling and early in the rains. So the increase in the surge is because of contamination of water and rise in mosquitoes which are bred in the flowing water or contaminated water or stored water. So that is the commonest reason why we see the rise in the diseases.
So as we know that monsoon is the season that most of us fall ill. So what are some of the most common illness or diseases that you encounter in your clinical practice?
Yeah, as we discussed earlier, the commonest one is malaria, next is dengue, next is typhoid. So followed by, there are a few other viral infections, or we call rickettsial and spirochetal infections like scrub typhus and leptospira also, which will be seen more commonly in the early of the rainy season. Because especially if you talk about leptospira, it's a waterborne disease. It is a spirochetal disease where once the person gets in contact with the contaminated water, or if he drinks the contaminated water, he gets the infection. So the similar presentation will be there in even any viral fever as in dengue and other rickettsial fevers. The fever will be very high grade, headache, body pains, myalgias. But the spread, for example, if it is dengue, it is spread by mosquitoes. If it is scrub typhus, it is spread by what we call mite bite, or shigar we call. And if you see leptospira, it is a waterborne disease. So the presentation will be different, but all three diseases are in the rise during the monsoon season along with malaria.
So doctor, as you mentioned that there are different presentations for different diseases. So what are the common symptoms or red flag signs that one should be aware of or should seek medical attention immediately?
If it is malaria, initially you will have very high grade fever touching 103, 104, 102, 103, and along with chills and we see evening rise of temperature. This is the commonest presentation in the malaria. And if you see dengue, the fever will be again high, it might touch sometimes 104, 105 also. But the fever will be, most of the times it will be continuous. And in dengue, what we see is there will be severe myalgias, body pains, and severe eye pain, what we call a retroorbital pain, where the patient sometimes can't even turn the eyeballs to from one side to other. And if it is in diseases like scrub typhus, you'll see the patient will have fever, but it might not be that high grade as we see in the dengue, but the myalgias will be there, and arthralgias will also can be there. And one more disease which we see in this season is chikungunya, which can present with fever and arthralgias. It is also spread by mosquito bite, by Aedes aegypti mosquito.
So we know that most of the viral illness are self-limiting. Otherwise, what are the common tests that are usually done at the hospital?
Most of the viruses are self-limiting viral illnesses. If it is common cold, as we see initially, there might be cold for cold sneezing and mild fever, myalgias initially lasting for 2 to 3 days. And if patient is having fever, headache, body pains, and if there is a retroorbital pain, as we have discussed earlier, better to get dengue. So for malaria, what we need to do is simple peripheral smear is enough. Coming to dengue, once there is established thrombocytopenia on day 1, on day 2, day 3 of fever, we need to send dengue NS1 on day 4. And if the fever has crossed more than 6 days or 7 days, we can send a dengue IgM and IgM for diagnosis of dengue. And if the patient is having fever, thrombocytopenia and associated any renal or hepatic involvement, we need to suspect. And if dengue is positive, we need to suspect other rickets cell infections or spirochetal infections like scrub typhus and leptospira. Scrub typhus is diagnosed by a test called Weil-Felix test, which is available in most of the centers. So high index of suspicion should be there once you have a patient presenting with fever more than 5 days with thrombocytopenia, aka hepatitis. So to diagnose scrub typhus or leptospira.
So we know that most of us are prone to falling sick, especially during monsoon season. But are there any particular group of patients who should be extra cautious or should take extra care, especially during the season, doctor?
Yeah, definitely any sudden change in the temperature, the most affected group are children and elderly. Because children, what happens once in the starting of monsoon season, once schools open, there is a sudden fall in the temperature, they'll get initially small cold or cough, and they exposed to multiple people in the school. And elderly also, and especially in people who are more than 65 years suffering with diabetes and hypertension, or patient who have already undergone any cardiac bypass or post-stenting people, and people especially with post-transplant people. These are the people where the immunity power will be low. So these are the vulnerable group, what we say.
So doctor, are there any vaccines that you would recommend, especially during the monsoon season?
Influenza, which is a seasonal fever, and especially starts in the monsoon, there is a vaccine. We call it influenza vaccine, which changes every year. So any person or people who are vulnerable, which we have discussed earlier, they should be taking a influenza vaccine every year. So typhoid vaccination can also be taken. Dengue has virus has a vaccine, but it's not available so easily, and even the effect of the vaccine is also not that high. Because dengue has 4 strains, if you get one strain this time, you can get another strain next time. We have a vaccination called pneumococcal vaccine, which can prevent more than, there are 2 strains, it can prevent more than 20 types of strains. So better to get a pneumococcal vaccine and influenza vaccine as per the prescribed schedule, as per the physician, according to the patient.
I'm sure we all love eating pani puris by the roadside. So what are the precautionary measures that we all should take to prevent falling sick, especially during the monsoon season, doctor?
Yeah, once the rainy season starts, but once the temperature drop, everybody starts going outside and having this pani puri or any chaat, whatever it is. So most of the times, anything which is properly cooked, hot food, we might not get infected. But anything which is not cooked, like the liquid in the pani puri, is we can't guarantee, and we don't know what exactly with which water it is prepared. So that is a commonest contaminant source where the patient can have acute gastroenteritis, diarrhea, and sometimes they can have even typhoid. So better to avoid anything which is not properly cooked, and better to avoid outside food as much as possible.
So before ending this episode, doctor, what message you would like to give to our audience out there as far as monsoon health and care is concerned?
Yeah, especially the main preventive measures is once the rainy season starts, you check your surroundings, see that there are no pits around the house. Sometimes, most of the times now, everybody has a air conditioner in their house. So the water which is collected outside the because exhaust water or dropping water which is collected in the bucket should be disposed on daily basis, because any stagnant water or any water which is locked for more than 24 hours, it it becomes the hive for the mosquitoes to grow. Better to use mosquito repellents and Odomus or something which prevents mosquito bites. Because once you prevent yourself from mosquito bite, you can avoid malaria, dengue, or any other, even chikungunya also. So prevention is the first thing, and along with that, we need to maintain proper hygiene. So before having food, better to have proper hand wash with soap or detergent, whatever is available to you. And when you are eating outside, see and eat, and better not to eat food which is not properly cooked.
So thank you, Doctor. It was wonderful having you here on the program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic monsoon health and care, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.